Hi, this is Philip Fritz with Mission Health, here to talk about coronavirus. Joining me today is Dr. Bill Hathaway, Chief Medical Officer for the Mission Health. Thank you for joining me.
Thank you for having me.
Let's talk big picture. We're seeing coronavirus in the news. What's happening globally?
Well, I think it's no secret to anybody. This pandemic, began in China and found its way around the country. The World Health Organization officially declared it a pandemic a few weeks ago, which just means that it has global reaches in all continents right now. We are starting to see cases here in the United States. We have in the neighborhood of a few thousand cases fully identified. And we fully expect that those case numbers will continue to rise over time. It's a virus that is a variant of a virus which actually causes the common cold. There were a few other serious epidemics with this type of virus, and this one is a little bit different in that it has really a global reach right now.
Let's talk about the curve. We're hearing a lot about that and flattening it. What is the curve?
Yeah, this is. I think this is one of the most important things we're going to discuss this morning. As we face a pandemic, we know that many people in our community are likely to become affected by this illness because of its transmissibility. This is a small virus particle that, like the flu, is highly contagious. But unlike the flu, we don't have a vaccine to prevent this illness. And so as we look at who's likely to get affected predominantly, or most severely affected, the elderly, our goal is to make sure that we slow the rate by which people get ill. In healthcare, we have a certain number of beds where we can take care of patients of finite capacity. And we know that if we get a barrage of patients quickly, and then the disease spreads rapidly throughout our community, we can actually overwhelm our ability to take care of patients. That's actually what happened in China. The disease spread so quickly that they were unable to handle it with the number of beds they had in their hospitals.
Right.
If we can flatten the curve instead of a curve that peaks quickly, but a curve that goes longer and lower, so we stretch out how long we face the illness, then we will have more resources to take care of those patients. So it's critically important that we work right now on our preventive measures to slow the spread of this illness. Good news, Philip, is that we don't have any cases. Well, we have one case identified in Western North Carolina at the time of this conversation. I fully believe there's probably unidentified cases out there, but we have the advantage that we have the chance to prevent this by some very critical measures in our community right now.
That's good to hear. What type of preparation has Mission Health taken to prepare for something like this?
Well, we've been actively involved for over a month. One of the advantages of being part of a large health system is that we have resources distributed across the country, and we have experiences from our fellow hospitals in California and Florida who have experienced a more rapid rise and spread of the epidemic in their community. And so we've taken those knowledges and learnings, and we've done a variety of different things. The first thing that we did was restrict visitation. It's preventing our healthcare workers and our patients from being exposed. And so we've limited who can come into the hospitals and have checkpoints at every door, screening patients and their family members for symptoms. If you're a patient and you have symptoms compatible with this illness, we put a mask on you, we send you to the emergency department and get you in isolation right away. If you're a family member who may have signs or symptoms, then we ask that you not come into the hospital if you have respiratory symptoms or any flu-like illness. That's tough on some people because their loved ones are in the hospital, but we think it's really critically important to protect our patients and caregivers. One thing we don't want to have happen is have a rash of our caregivers get sick, so then we can't care for the rest of the community.
Right, good point. We're hearing two words, screening and test. What's the difference between the two?
Yeah, so a screening is an assessment of whether you're likely to be at risk for the illness. And so that involves questions used to relate to travel. Travel is becoming less important as the illness moves around the world, although it's still important. If you were in a super high-risk area, what we refer to as a hotspot, then your risk goes up. And then we ask about questions of shortness of breath, cough, and fever. All sniffles and snuffles are not necessarily put you in a high-risk group. We obviously have concerns about that, but they don't put you necessarily in the high-risk group. If you screen positive, you have symptoms compatible with the illness, then we consider whether or not you should be tested.
Okay, you mentioned symptoms. What are some of those symptoms?
The big symptoms that we know, and they vary from person to person, and what we're learning as the pandemic progresses is that people can have anything from very, very mild symptoms, just a cough, sore throat, shortness of breath, to very, very severe, and often with fever. Fever tends to be a hallmark, but you don't have to have a fever to have the diagnosis. All the way to severe respiratory distress, failure, shortness of breath, very, very severe illness requiring hospitalization.
Okay, now what if I have those symptoms? What should I do if I feel like I need to be tested?
Yeah, I think the important thing that we want people to do is not to rush to the emergency department with mild or moderate symptoms, and not to rush to your doctor's office with mild or moderate symptoms, but to call.
Okay.
It would be best if you could call and get in touch, talk to them about what they want you to do, your primary care doctor, and then have them triage you to the proper location to get evaluated and get tested. For some people, it may be the emergency department. For some people, it may be the doctor's office. For others, it may be a walk-in clinic. We need to individualize that decision. It's important that we don't flood our healthcare system with people who might not otherwise need to be cared for.
Okay, good point. Now we're hearing the word telemedicine pop up a lot in the news. What is that, and how could that help slow the virus?
Telemedicine is interesting because it really encompasses a whole variety of different circumstances. It could be as simple as a phone call, talking to the patient. That would be low-tech telemedicine, as it were, to robotically assisted video telemedicine. We actually have a platform at Mission Health that we're encouraging people to use who don't have a primary care physician or otherwise can't get in touch with their primary care physician. It's what we call our virtual clinic.
Okay.
It's available at missionhealth.org/virtual clinic. And by logging on there, you can put in your symptoms, get screened, and then be referred to the appropriate place for additional evaluation.
I've used that. That's very convenient.
Yeah.
Let's talk prevention. What are some of the best ways to prevent that exposure to the coronavirus?
Well, I think people are well aware that both county and state organizations have declared an emergency. And part of that emergency declaredness has emphasized the need for social distancing. So first and foremost, the things that we recommend to prevent any infectious illness is wash your hands, touch as few objects as possible when you're in public, limit your exposure to groups or other people as much as you can. Stay more than 6 feet away from people if there's any signs or symptoms of the ability to transmit a disease. And then avoid large gatherings of people. And as we know, the president has asked us to avoid gatherings of 50 or more. And now I've heard recent talk about even of 10 or more people together.
Well, we're hearing, it's easy to hear negative news about this from neighbors, from friends. Let's end on a positive note. How can Mission Health System help keep Western North Carolina safe?
Well, I think we do that every day by the nature of our role as a tertiary and quaternary care hospital for the region. We are the critical care hospital for Western North Carolina, and we recognize our role. The most important thing that we have to do to care for our patients, communities, family members is our people. And we have a world-class medical staff supported by absolutely the best nurses in the community and in the country. They're compassionate, they're talented, they're dedicated, and we can count on those people who work with us to be there when we have this illness. In addition, we have world-class facilities. We have capacity. We have lots and lots of space where we can take care of these patients right now. I'm not particularly worried about that. Remains to be seen how we'll be affected by the epidemic. We have to flatten the curve, as we talked about earlier. But I'm confident to this point in time that we'll be able to meet the need. And as we've always done together, we've come together as a community whenever we've faced hard times. We're working very closely with both the city and county governments as we address this issue locally. We're working closely with other counties throughout the region. Of course, Mission Health has hospitals throughout the 18-county region, and we will care for patients in all these locations. And we're cooperating with other health systems to have a unified effort to meet the needs.
Very good information. Dr. Hathaway, thank you so much for joining us. Thank you for watching. Stay healthy and keep those hands clean.